In this video, we will study about the regional odontodysplasia, which is also called as a ghost teeth, odontogenesis imperfecta, odontogenic dysplasia, ghost teeth, odontogenesis imperfecta, odontogenic dysplasia, and odontodysplasia. Odontodysplasia. You have to remember the three important names: ghost teeth, odontogenesis imperfecta, and the regional odontodysplasia. So basically what regional odontodysplasia is, as we know that the regional is a word that is localized to one quadrant or the localized to something. So it is localized to one quadrant, odonto for the tooth, and dysplasia, that means the abnormal development of the cells. So it is a developmental disturbance affecting the structure of the tooth, that is enamel and dentine. So what is the definition? It is defined as a development disturbance of one or several adjacent teeth of unknown etiology characterized by deficient formation of enamel and dentine. Very important, there is a deficient formation of enamel and dentine. So what will happen if enamel and dentine of the tooth is deficient? There is a thin enamel and thin dentine. So underlying there is pulp, so there is an increased size of the pulp chambers, so which results in an abnormally enlarged pulp chambers and imparts a ghost-like radiographic image to the affected teeth. Such teeth erupt into oral cavity late. So it is called as a ghost teeth. Why? Because it's that of the radiographic appearance. Because pulp chamber is normally radiolucent and there is a fuzzy type of radiolucency seen due to the increased size of the pulp chamber. So it appears like that of the shadow of the ghost, so called as a ghost teeth. So it can affect the maxillary teeth as well as the mandibular teeth. But the maxillary teeth are most commonly affected than that of the mandibular teeth. It can affect the both dentition, permanent as well as the deciduous teeth. So most commonly affected teeth are the maxillary, permanent, central incisor, lateral incisor, and cuspids. So if it affects the mandibular teeth, the same type of teeth will be affected. And there is no racial predilection for the ghost teeth, but the females are more commonly affected than the males. We don't know the definite cause of the ghost teeth or the regional odontodysplasia, but there are several predisposing factors. So these predisposing factors, first is a hypophosphatemia. So it is a generalized condition in which there is a decrease in the amount of the phosphate in blood. So the second condition is a hyperpyrexia, and third one is a rhesus incompatibility. It may also occur due to the drug consumption during the pregnancy, or if there occurs some localized infection, some local infection. So coming to the clinical features, so there is a late eruption of the tooth and it may appear the yellowish brown in the oral cavity or the irregular in appearance. So there occurs a delayed or the failure of eruption. Delayed or failure of eruption. There is early exfoliation of the tooth if erupted. And there is a high chances of the abscess formation in this tooth, because as we know that the pulp is enlarged. So there is a malformation of the teeth and non-inflamed gingival. It may be accompanied by the non-inflamed gingival enlargement, and there are high tendency of the formation of pulp stones. So it appears irregular, and pulpal necrosis is very common because there are enlarged pulp chambers. Why there occurs a delayed or the failure of eruption? Basically, why there occurs a failure of eruption? Because of the dentinal clefts, because of the presence of dentinal clefts. Coming to the radiographic features, so you can see in the OPG, the first molar, the first maxillary molar, there is a large pulp chamber. So pulp is radiolucent. So there is decrease in the radio density. Normally the tooth is radio dense and the pulp appears as a radiolucent. But in this there is thin enamel and thin dentine. So radio density decreases and radiolucency increases. So it gives a ghost-like appearance, so called as a ghost teeth. So enamel and dentine are very thin and there is a large pulp chambers. So coming to the histopathology. So these are the diagrams you have to draw. So in the histopathology we see the several characteristic features. First is a decrease in the dentine formation or the defective demineralization of dentine, and there is a widening of the predentine layer. And third is there is a increased thickness of the widening of the pedial space. And there is irregular arrangement of dentinal tubules. And there is a high interglobular dentine. So large areas of interglobular dentine are present which are hypomineralized. So there is increase in the follicular tissue and there may be the presence of the odontogenic epithelium also. And there is a presence of basophilic calcification that looks like of the enamel. So these are called as the enameloid conglomerates. These are the basophilic calcification seen in the tooth affecting with the regional odontodysplasia. So oid is a word used for the like. So these are the enamel-like calcifications seen in the ghost teeth. So this is a decalcified and the ground section of the tooth. So ground section you have to draw with your HB pencil, and in this you can see that there is a thin enamel, thin dentine and irregular arrangement of dentinal tubules, increase in the thickness of predentine layer and widening of pedial space. And in the decalcified section you can see the basophilic calcification that are called as the enameloid conglomerates, and this is a irregular arrangement of the dentinal tubules, and this is a increase in the thickness of predentine there, and follicular tissue increases and pulp stones are present in high amount. So these are the two diagrams you have to draw in your exam. So what is the treatment of the regional odontodysplasia or the ghost teeth? So as we know that they appear very unaesthetically, so we have to go for the extraction or we have to go for the prosthetic appliance after extraction. Thank you.